Welcome to the Opiates Don't Discriminate webinar that's done by Strathcona County in partnership with the Canadian Municipal Network on Crime Prevention and for the 40 Days Safer Cities Challenge. And we're really excited having you here and talking about this promising, really interesting, and I think incredibly meaningful project around stigma of opiates.
Good morning, everyone. Thank you so much for joining us today. My name is Michelle Jen, and I work as the Manager of Community and Social Innovation for Strathcona County Family and Community Services. Today, I'm going to be sharing our community's journey of creating the Opioids Don't Discriminate, an interactive experience. In 2018 and 19, this exhibit welcomed approximately 1,200 visitors. The interactive installation profiled local statistics, opioid information, and local support organizations, while immersing participants in an interactive journey through the stories of 3 fictionalized characters. As they went through the exhibit, participants learned about the science of addiction, the impacts of opioids, and how the crisis is affecting people locally, provincially, and nationally. I'm really excited to be participating today in the UN Habitat 40 Days Safer Cities Challenge and to present on our community's journey of creating the exhibit and the resulting do-it-yourself kit, and the impacts that these initiatives have had on many communities and their residents. Before jumping into the work of the Opioids Don't Discriminate, I'd like to provide everyone with a little bit of context about our community. Strathcona County and some of the challenges that we were observing in our community that led to the creation of this exhibit. Strathcona County is located in the heart of Alberta, Canada. Our community is located approximately 20 minutes east of the capital of Edmonton, or capital of Alberta, Edmonton. Strathcona County is home to 98,000 residents, and the total population is 71,332 people who reside in the urban area of the community, Sherwood Park, and 27,000 reside in rural Strathcona County, which includes farms, acreages, and smaller hamlets. It is for this reason that Strathcona County is considered a specialized municipality, meaning that we have both rural and urban populations that work together and govern as a single municipality. Historically, Strathcona County has been known as a vibrant and economically successful community, due in part to the energy industry. However, since 2015-16, the county has been was impacted by a province-wide economic downturn, which has created changes within the community. In recent years, Strathcona County has seen increases in crime rates, mental health referrals, reported incidents of family violence, food bank usage, and an increase in demand for local supports. In our community, 1 out of every 10 families consists of lone parent families, and 4% of Strathcona County households fit into low-income category. Some of the recent challenges that we have observed in our community have been further exacerbated due to local economic and social challenges brought on by COVID-19 pandemic. The full scale of this impact has yet to be understood. In 2016, the province of Alberta recognized a growing opioid crisis and announced that it would be implementing a range of new approaches to address the overdoses and deaths related to fentanyl and other opiates as a part of an urgent government response to reduce the harms associated with opioid and drug misuse. In Strathcona County, startling local statistics, including a dramatic increase in the number of emergency department visits for opioid use and an increased number of opioid-related deaths, spoke to the need for local action. Provincially, the first to second quarter of 2020, apparent unintentional opioid deaths related to fentanyl in Alberta more than doubled, from 130 in Q1, quarter 1, to 284 in Q2. The provincial rate of emergency department visits related to opioids and other drug use increased by 22% from the first quarter of 2020 to the second. So that's 3,000 visits in Q2 and about 2,500 visits in Q1. These numbers show the challenges that people are facing and the dire impact that this pandemic is having on their lives. In Strathcona County, over the past 5 years, 573 emergency department visits were drug-related. 80% of these were attributed to opioid use. From 2016 to March of 2020, there were 27 opioid-related deaths in Strathcona County, of Strathcona County residents. 81 of these involved fentanyl or fentanyl analog, and the remaining 19 did not involve fentanyl, but involved other non-fentanyl opioids. These circumstances led to the creation of the Strathcona County Drug Strategy Committee, made up of local organizations committed to addressing the crisis. Although initially formed to address the local opioid crisis, a deeper examination made it clear that all addiction is serious and does not discriminate. The opioid response was an opportunity to create broader, community-specific drug strategy that would take a different approach to addiction by focusing on risks, risk reduction, open conversations, and an effort to reduce social stigma. The committee developed a community drug strategy for Strathcona County based on the four-pillar approach first implemented in some European countries in the 1990s. The four pillars are prevention, treatment, harm reduction, and community inclusion and safety. The pillars are closely related and interconnected. Early conversations with the committee and experts and leaders in the field of addiction and mental health questioned why such a pervasive issue has been plaguing our society for so long. What are some of the fundamental issues concerning addiction? We were challenged to reshape fundamental worldviews and assumptions that have driven theories of addiction for decades. What surfaced was a new mental model based on collective understanding and ownership of the issue, a shift in thinking. This included the recognition that the crisis is happening in our own backyard, which opposed the pervasive belief that such issues were not a concern in the beautiful community of Strathcona County. The model is founded on a journey-based approach to address root causes and recognizes that recovery is at the individual, family, and community levels, a systems approach, if you will. It is based on the understanding that humans require social connection for emotional resilience, and that the opposite addiction is not sobriety, it is connection. The committee came up with 4 shifts in behavior that would set the stage for future work. These include shifts from addictions to connections, from isolation to inclusion, from stigma to compassion, and from shame to acceptance. During the national opioid crisis, Strathcona County Community Drug Strategy Committee was granted the opportunity to develop an opioid awareness campaign. We aimed to do something beyond traditional awareness building, information campaigns, and wanted to take a different look at the crisis going on in the community and around the country, and support public education and learning about opioids and addiction. To do this, we harnessed the power of story to build empathy and begin conversations in our community about substance use. The initial awareness campaign ideas were laid out by a small group from the municipality and drug strategy committee, using research from local and global health, literature and data, information from the work being done in Portugal, to Johan Hari's presentation, Everything You Know About Addiction is Wrong, was used in some aspect to inform this project. Using a systemic design approach, narratives were developed with the help of residents with lived and living experience with opioid addiction. The narratives were rooted in the science of addiction and founded on the new thinking that was underpinning the Community Drug Strategy Committee's work. Some of these capabilities and competencies, combined with the power of lived experience research, empathy mapping, interaction, and industrial design, provided a safe container with which the project took shape. The team worked to design an exhibit prototype that supported and supports individuals to understand the complex brain science of addiction and to experience the journey firsthand as though they themselves were going through it. A key innovation of the Opioids Don't Discriminate exhibit was to take participants on a journey. The image on the slide depicts the journey that the exhibit participants were taken through when they visited. The information section. So this exhibit structure was structured so that the participants entered and they were presented with information and facts. Followed by stories. Participants then proceeded to follow the stories of one of 3 characters based on lived and living experience. The stories drew participants in to understand that addiction can grow into anyone's life. The stories healed to build empathy and reduce stigma. The crisis node was an emotional component that attempted to share the feelings of those living with addictions. When working with those with lived and living experience, it became clear that each journey led to some form of crisis. It was explained that when opioids takes over your mind, it manages to hijack your thoughts, changing your behavior. Whether it was a car accident, an emergency department visit, overdose, or other events, each story had led to a crisis point that was depicted through very personal thoughts and emotions described by those with lived and living experience. Hope. The exhibit then transitioned into a hopeful emotional space with messages of hope and welcoming, empathetic people embodying the importance of connection, followed by nourishment. After participants walked through the exhibit, they entered a nourishment area that provided space for reflection and allowed participants to process the experience. We provided food, resources, and support services to harness an atmosphere of reflection and support. Action. The final section of the exhibit provided opportunities for participants to engage in action with local partners. We had naloxone training and other service providers to give educational presentations. That sums up a little bit about the exhibit. Another key innovation that informed and inspired the development of the exhibit was to ground the exhibit in research, data, and most importantly, local lived and living experience. Personal experience was the cornerstone of the stories brought to life through the three characters showcased in the exhibit. When engaging with individuals with lived and living experience, it is important to adopt a trauma-informed approach that supports individuals in telling their stories. Each individual who offered up their personal experiences became designers of the exhibit. They held a space of creativity and problem solving to help personalize the exhibit so that its manifestations would capture the true journey of someone walking through a pathway of addiction. Taking special care to ensure rights to privacy, safety, security, and dignity of those who you might engage with are paramount. The approach of the exhibit was to build empathy by humanizing statistics on local opioid drug use through the narratives depicting real-life scenarios that people can relate to. Iterations of the exhibit were created and continued to be tested with those with lived and living experience to ensure that the scenarios were realistic and meaningful. The personas of David, Max, and Natasha were created based on these experiences of people who have been negatively impacted by opioid use. When people entered the exhibit, they chose a character and walked through their journey. There was information to read, listen to, and physically touch to better understand what each character was thinking and feeling at different points in their journey. I'm just going to share a little bit about each character. As was indicated in some of the exhibits, it's important to kind of get a sense of how the personas played out a little bit. So Max was considered as smart and reliable. He loves reading, math, sports, and his cat. He loved to draw and paint buildings and cityscapes and works hard at school so he can apply for post-secondary scholarships to study architecture. Max grew up in a small town with the same friends, but his parents are separating, so he and his mom and brother are moving to a new city to be near his grandma. His grandmother, she just had hip surgery, and so she needs a lot of help, and Max is trying to help out as much as he can. Moving and his parents splitting up has really been hard, and even though his dad travels a lot, Max misses him. So that's just a snippet of some of the narratives that were depicted on some of the frames in the exhibit. We have one for each. Just move on to the next part. So Opioids Don't Discriminate was a free event. It was open to the public, designed and created for individuals and families, parents and youth aged 12 and up, although some younger families with younger children came, which was fine, to learn more about the opioids and the concerns of addiction, the crisis, and available local supports and resources. Over the 6 days, as I mentioned earlier, 1,200 community members visited, or 1,200 people visited the exhibit. School groups were provided busing to get to the event and given guided tours through the exhibit, as well as naloxone training that was provided towards the end of the exhibit. Over 40 regional partners came together on a guided tour, followed by a dialogue and discussion about what else could be done and possible support. At the end of the exhibit, participants reported that they knew more about opioid addiction than when they had arrived, and they felt more compassion towards those struggling with opioid addiction. Because the exhibit was emotionally intensive and possibly surfacing some emotions for individuals, we found it important to have counselors, support staff on hand to support any emerging needs of participants. Community organizations supporting the individuals and families with addictions they were also stationed at the end of the exhibit to provide participants with resources and any further information or support that was required. The Opioids Don't Discriminate interactive exhibit took an innovative approach to raise awareness about the crisis. The goals of the exhibit went beyond providing information. The exhibit aimed to reduce stigma and increase empathy for those living with misuse and to inspire participants to act. The following video will better provide you with the sense of what the exhibit looked like and the impact that it had on our community. So I'm just going to try playing a small video here. I'm hoping that everyone will be able to hear it. Felix, if you wouldn't mind just letting me know.
I have to tell you, I'm super excited. Today we are here for the official launch of a truly groundbreaking project entitled Opioids Don't Discriminate, an interactive journey. This interactive event challenges our assumptions about addictions specifically related to opioids.
The characters of Max, Natasha, and David are fictional, but the journeys they speak to are real life experiences shared by people who have been impacted by opioid addiction in our community.
The effects of the opioid crisis are far-reaching. It cuts across communities, including in the suburbs, rural areas. It cuts across age groups, young people, older people, seniors, and generations. On average, 2 people a day in Alberta die of apparent opioid overdose. Last year, Alberta lost more than 700 people to this crisis.
My story always starts here with our son, Danny. Danny died from accidental fentanyl poisoning in 2014 when he was 25 years old. One of the greatest barriers to providing more effective supports is stigma.
Stigma, shame, and fear prevented people from reaching out for help. Many people who use opioids fear being judged.
But as a society, we need a paradigm shift away from treating substance use as a criminal justice problem to approaching it as a health and indeed a human rights issue. Because criminalization is really the most extreme form of stigma. In Alberta, drug poisoning has become the most common cause of death for men under 40, ahead of traffic fatalities or suicides.
Opioids is a crisis that Anishinaabe people, Nahiwik people, Indigenous people know all too well. I've buried family members, and I've had to go give last rites to lots of my people across Canada. And the pain that it brings to people, it sticks with you. It stays with you. I've seen people as young as 13 years old being addicted to Oxycontin.
In order to make a dent in this crisis that is impacting and killing so many, each of us needs to be a part of the response. And it's our hope that this interactive journey will prompt a new way of thinking that moves us from addiction to connection, from isolation to inclusion, from stigma to compassion, and from shame to acceptance.
It's one of the many creative initiatives that are being implemented that show the true face of the opioid crisis. And the true faces are the faces of our loved ones.
All right. And the purpose of the Opioids Don't Discriminate exhibit was to reduce stigma, as I mentioned before, judgments and biases about people who use these drugs and those affected. The event aimed to create a better understanding of drug use and local available supports. Over 6 days, just a little bit about who attended. Approximately 1,200 participants attended the exhibit, ranging from ages between 10 and 85, a huge age range. So 55.8% of participants across the two events were 18 years old or under. And 20% of participants came from the health and social services field, and 23 were in other occupations. 18% reported knowing someone who was addicted to opioids. As part of the exhibit, we asked participants to anonymously fill out impression surveys before and after the exhibit experience. These captured both quantitative and qualitative data that we collected based on demographic information. Then we asked a few open-ended questions and some multiple choice questions to gather impressions about those living with addiction. Familiarity with opioids, opioid misuse, and attributes to the importance of full and healthy life. From the evaluation, we learned that the exhibit had 3 major impacts on participants. The first was knowledge of opioids. Participants reported an increased knowledge about opioid misuse and resources. 81% of the participants agreed that after the exhibit, I am more knowledgeable about opioids than I was before. And indications of empathy. So this was a very tough one that we tried to get a sense on or get some indication of. And many participants attending the exhibit reported feeling a greater understanding that opioids addiction doesn't just happen to other people because of bad choices. This sort of captured what we heard. And that 56% of participants agreed that I feel more compassion towards people struggling with opioid addiction. And 60% of participants agreed that during the exhibit, they shared the characters' feelings. At the community level, community impact, participants shared ways that they would take this experience forward, including talking with friends and family and more actively modeling compassion. 94.8%, almost all, participants agreed that this exhibit was important. When we first developed the exhibit, we thought that it would be a great opportunity for our community to learn more about addiction. What we didn't expect was, as part of the components around action, I guess what led to what came next was that other municipalities in our province would want to borrow the exhibit and share the exhibit with their residents. To date, the exhibit has been shared with 3 additional municipalities across Alberta and has been requested by an additional 12 municipalities and organizations between Alberta and BC. A surprising impact that came from the exhibit was the interest from these communities to do something similar in their municipality. And because of this, Strathcona County thought of a way to continue to share this interactive exhibit. To support other communities to increase awareness and empathy on this challenging topic, Family Community Services has created a do-it-yourself kit that can be used in any community. The do-it-yourself kit is intended to explain the approaches, concepts, tools, and learnings used to design and run the exhibit. It is a way to share key aspects of the exhibit for those who might want to do something similar where they live. It is also a way to enable further action to support those affected by the opioid crisis. The DIY kit is available for download on the Strathcona County website. I'd just like to share a few quotes from some of the participants. There was so much information that we gathered, and we were very intentional about evaluating this and trying to get a sense of whether or not it had an impact. And what was most important, and just even going through the information and data, was just some of the thoughts that were shared. And so I'll just share a few participant quotes. I've dealt with plenty of pain. I feel lucky that I've never been prescribed opiates. If I know someone struggling with opioid misuse, I will give them the support and help they need. Life gets hard, and some people take life-threatening measures. It's okay to not be okay. There are ways to get back your life, the life you want, the life you deserve. I will be more aware and ask tough questions if I see someone who may be struggling with opioid use. Be more compassionate and less judgmental.